In Peel Region, more and more calls are coming in from people in distress, especially since the pandemic began. The police force here is taking a new approach at de-escalating mental health situations and getting people the proper help. But according to one family, right now the need is much greater than police and the new crisis units can handle.
When we needed the police to be involved, that's where we didn't get their support.
We've agreed to keep the identity of this woman anonymous and call her Marie instead as she shares intimate details of her brother's struggle with mental illness.
He was delusional and he believed that he worked for Peel Regional Police.
Marie tells me her brother was diagnosed as bipolar 2 years ago and recently went into psychosis. One night last week, he called 911.
But because he said he wasn't a danger to himself or anyone else, they could not detain him.
After making calls to the Peel crisis line, the family went to a justice of the peace to get an examination order, also known as a Form 2, and was advised to get him to CAMH as soon as possible. That day, Marie says they went to the closest police division asking for help getting him there.
My mom had pushed to speak, to somebody else because the officer we were speaking to was not helpful. And the actual comment that he made was, "We're not a taxi service."
As of now, Peel Police only have 2 mobile crisis rapid response teams for the entire region. These units pair officers with mental health clinicians, but are only available 12 hours a day.
An officer just doesn't have that caliber of professional training to be able to navigate that.
It's been a full year now since the crisis rapid response teams have been in motion. Peel's police chief tells me they are seeing successes when the crisis teams are deployed. For example, when only officers are attending, 83% of calls end in an arrest under the Mental Health Act. But when the mental health nurse is on scene, arrests are only made 21% of the time.
I'm assuming the units are only attending to a fraction of the calls that come in.
It's literally a fraction. We have 1.4 million people here, and two units a day just doesn't do the trick.
And Peel's police chief believes even more can be done on this front. While it all comes down to funding, he would like to see 8 crisis response units in the coming years. And requests have already been made by the Peel Dufferin Canadian Mental Health Association to get 2 more by the end of 2021.
To have, an officer be the only line to get help in and of itself poses the question of where the system is really not appropriately oriented, and it's got to change.
And the police chief tells me Peel Region is looking at other ways to incorporate mental health professionals into their everyday, such as having a clinician available at the call center to help assess situations as they arise. In Mississauga, Shauna Hunt, City News.